Hello and welcome to Noted. And this is a weekly program where we meet up with experts on different topics. Our guests can be from various professions. And this week, we were very excited to know more about, of course, COVID-19 prevention, but also this is where we're seeing technology, drone plus artificial intelligence. To tell us more about, let's meet up the researcher himself, Dr. Ahmed al Maashri. Welcome, Dr. Ahmed.
Hello, Lakshmi. Thank you for having me on.
Thank you for joining us. I know you've got a very busy schedule, but we must get to know. This is very exciting because I think it is going to save a lot of not just time, but also health of the frontline workers. So we are actually protecting them. And tell us more about it, Dr. Ahmed. How did you come up with this idea, first of all?
All right. So last year, when the pandemic started, there was a great concern about detecting potential cases just to spread the infection rate, as you know, the flattening the rate and so on and so on. So there was an interest from the Ministry of Health to have a similar kind of system where they can be able to detect potential cases or suspected cases from a distance. So that's basically where the team started working on, materializing or embodying that concept, where we have a drone equipped with thermal and visual cameras, and that drone can be dispatched to an area where there is some suspicion that there might be, infections, and the drone will basically survey the area. It will send out both thermal and visual images to our servers. We have developed many algorithms, AI algorithms that will process these images. And then we'll try to do two things. We measure the temperature of individuals. We can do multiple individuals simultaneously. And at the same time, we try to recognize their actions, because not only want to measure the temperature, but we also wanted to recognize whether they do actions that are similar to the symptoms, like coughing and sneezing. And then we basically blend the two together, the measurements with the action recognition, and then we try to figure out if we really have a potential case or not. So that's basically the idea in a nutshell.
So how fast are the results taken? And is this because of the prototype capable of detecting COVID-19? How you mentioned, the symptoms or the actions such as sneezing or coughing could be detected?
So dispatching the drone, since it's drone, it doesn't really have the similar barriers or obstacles when you dispatch a medical crew to go to a certain location. So it takes minutes to reach the destination. Once you survey the images and then they are being transferred to our servers, it takes a matter of seconds for processing the images. So it's more of real-time processing as soon as we receive the images.
I can, so there is no need to go back to the lab, wait 24 hours for the results to come, because it gives you the first indication.
Right. Since we are looking for the symptoms, again, I just want to make this clear, because some of the audience or viewers, they may have the misconception about this. We cannot really confirm that this is a COVID patient. We can only say that this person has the symptoms for a COVID patient. So we are looking for the symptoms. We don't really confirm that a person is actually infected. That should require further lab work. And that's really, it's out of the premise of this project.
But at least it gives them the first, for example, where do you think this technology can be used? I remember the beginning of last year when they had community testing. So would this be one area, or could it be in airports, because that's where the crowd would come, because otherwise the measures are there where people cannot gather in any location. So are these kind of the areas where it will be used?
Yes and no. Yes, it should be used in outdoor areas where you have these residential compounds where it's difficult to reach it with the medical staff. No, not in airports, because in airports you can have these indoor thermal cameras.
Yes.
And as the passenger pass by, they will be detected. So you don't really need it in an airport. It actually would not really work in an indoor environment. The system was developed for outdoor environment.
Obviously, because the drone is flying. But
exactly.
That's true. You're the lead researcher, Dr. Ahmed, and how did it all come together? Your team, could you tell us more about it?
right? So the team initially was formed. It was myself, Dr. Ashraf Salim, and Professor Haj Burdousan. We are all from the same Department of Electrical and Computer Engineering. And right from the beginning, we knew how the system would look like, but we had to address the challenges. One of the challenges is that outdoor thermal cameras, they're not very accurate. They have been made for other kind of applications, for example, in oil and gas, where the error margin can go up to 10 degrees difference. You cannot have that with when you want to measure skin temperature. In skin temperature, it has to be accurate. It has to be less than 1 degree Celsius. So that was one of the challenges that we have encountered. How can we use AI to reduce that margin of error down to 1 degree? And because of that, we have developed the self-calibration mechanism where we basically use the AI to bring it down. The other challenge was that we have to detect actions. We have to recognize that a person is either coughing or sneezing or nose blowing, and that requires us to do a lot of field tests. We have to collect large data set and then feed it to our machines in order to train it so that it can automatically recognize all these actions. So once we have crossed that hurdle, things start to look in a better shape, and then we start to have good results that made us feel confident about this system and encourage us to continue in that path.
And when do you think it'll be available commercially?
Okay. People keep asking that question, but my response is the university, it's for in R&D. We don't really have spin-offs. We don't really have companies that can commercialize this product. We are more than happy to work with other ministry or other government bodies, or a company that would like to commercialize. We can work with them, but really the intention right from the beginning was to help the community. We didn't really have the concept of trying to make it commercial as a product. So if there is an interest, we can collaborate and figure out a way. But for now, we are going forward to publish the results, so it will be in the public domain.
Okay, that's interesting. Because then, would you be also giving it to the Ministry of Health for their use? And then
that's actually the
intention.
Yeah, that's what actually our intention is. Eventually, we perceive that the Ministry of Health would be the main beneficiary from these kind of systems. If other entities are also interested in this, we can work with them. Really, now we have a platform which can be customized to other purposes. As you know, COVID has symptoms that other diseases also have similar symptoms. So with a bit of customization, the same system can target probably other diseases or symptoms of other diseases. So we are more than happy to work with others if that's going to help the community.
Do you think it would be very useful for camps, labor camps, where there are hundreds of people working? They could benefit a great deal, won't you think?
Pretty much, yes, because as you fly the drone, and the drone can do measurements from a distance of up to 15 meters, which means that you don't really have to intervene. You don't have to go into the camp. You just have the drone to survey the location. It can be done in a few minutes. And then once you collect those images, you can actually identify individuals who have shown some symptoms. And the system will not only report the some biological information about the target, but will also give you the exact location, which means that later on, if you want to do more investigation on foot, then you could you can send your crew to that location. Exactly.
Finally, Doctor, this also would mean there would be a technology transfer and training if commercially companies want this, in addition to Ministry of Health. So would there be
true?
services?
True. So from one hand, you need to have trained pilots who would know how to deal with the drones, because we anticipate that you would have to dispatch the drones to locations that might be kilometers far away. So you really have to have a trained pilot. that would, he or she know what they're doing. On the other hand, you would have to have staff that they know how to deal with the dashboard that we created, so that when they receive images, they know how to start the AI algorithms. The AI will do its thing, and then they will get some results. So they should be able to interpret these results. So on both, you need somebody on the ground to pilot, and then you would have people in the lab where they do the analytics.
So would you be training them as well, if there are people who come forward?
We will find a way. I mean, I don't want to say something out in the public and then people will be knocking my door. But if there is a way to figure out a mechanism where there's transparent, flexible kind of transfer of technology, then we are all for it. Yes.
Thank you, Doctor. I can see lots of notes behind you on your whiteboard. So you are, obviously you teach in the computer field and electronics. Am I right?
I'm more into computer engineering.
Computer engineering. Okay. So you have classes today too? Or is it all online classes?
Well, all classes are now online, but these cripples because I'm too lazy to erase them. That's why they're there.
No, it's good. We have an idea how the classes go on online. I want to wish you all the best. I know you have more appointments for the day. And thank you so much for your time. And thank you for sharing us this knowledge and this news. It's excellent. Great. And
it's my pleasure. And thank you. And thank you for having me again, Lakshmi.
And that's Ahmed al Maashri, from Dr. Ahmed al Maashri, who's man behind the drone artificial intelligence technology that will be making it much easier for organizations like Ministry of Health or other organizations who require it in detecting COVID-19 symptoms or any other health symptoms, which is sort of correlated to COVID-19. And maybe there's more coming your way, actually, our way from you, Dr. Ahmed. Wish you a beautiful day. Thank you, sir.
You too. Thank you.